Welcome Team 4 presentation. Hi, I'm Jiyoung. Team 4 topic is AFAF MELEIS transition theory. In the middle 1960s, Melis was working her master's and PhD and investigated the phenomena of planning pregnancies and process involved in becoming a new parents and mastering parents' roles. She focused on spousal communication and interaction in effective or ineffective planning of the number of children in families. Subsequently, her research focused on people who do not make health transitions and the discovery of interventions to facilitate healthy transitions. At the beginning of the work, she defined transitions that unhealthy transition or ineffective transitions relate to role insufficiency. Also, she defined role insufficiency associated with the role behavior as perceived by the self or by significant others. This conceptualization leads Melis to define the goal of health transitions as understanding of behaviors, sentiment, cue, and symbols associated with new roles and identities and non-problematic process. She also believed that knowledge developed in nursing should be toward nursing therapeutics and not toward understanding the events related to responses to health and illness situation. Consequently, she introduced the development of the role supplementation as a nursing therapeutic as seen in her early research. As cited by Im 2017. Introduction of the theory. This theory focuses on to enrich our understanding of development, formation, as well as stressful responses to both predictable and unpredictable changes in human life. Moreover, transition theory introduces a broader view includes relationships, change over time, and the person in the particular situations, such as giving birth, becoming parents, growing up, coping with chronic illness, recovering from injury or acute illness, change in jobs and family structures, communities, or cultures all demands studying persons in their social relationships, contacts, and their experience of a transition into new self-understanding and new life world. This study needs Melis to question the nature of transitions and the human experience of transitions. So she developed the theory as a transition framework, and middle range theory included description of immigrant transitions, women's experience of rheumatoid arthritis, discovery from cardiac surgery, family caregiving roles for patients in chemotherapy, early memory roles for patients in Sweden, aging transitions, African American women's transitions to motherhood. These studies were conducted among cultural devices group of people in transitions, and her research population interests shifted to immigrants and their health and focus on global health, immigrant and international health, women's health, and the theoretical development of the nursing discipline. Based on the transition theory, it had developed as the theory of transition, middle range, and transition situation-specific theory, as cited by Melis 2010. Thank you.
Hi, I'm Shvinderjit, talking about the concepts and assumptions of Melis transition theory. Transition can be defined as a passage from one fairly stable state to another fairly stable state that is triggered by change. A normal nurse-client encounters takes place when the transition is still in the process. In this period, individuals are usually unstable because the changes of their health situation and environment. According to Malice, this instability affects both the patient and the care provider, and also aware us about the crucial concepts of the theory and the goals which help the people to go through the healthy transition. According to Malice, concepts of the transition theory related to role are developmental transition. The transition continuous takes place from the total life cycle from birth till death whenever changes takes place in their identity, ability, behavior, needs or role. Organization transition is encompasses changes in the area such as in the organization's structure and function and environment which affect the lives of the clients who are working in that organization. Situation transition involve the addition or subtracting of a person in an already existing or playing role in the society. Health and illness transition takes place when the diagnosis of chronic illness change from healthy to chronic illness, recovery process and hospital discharge. On the other hand, there are some properties which play an important role in the transition process. First is awareness. Awareness is frequently reflected in the degree of appropriateness between what is known about the process and responses and what are the expected set of responses and perceptions of an individual undergoing similar transitions. Engagement is the degree which a person demonstrates involvement in the process of transition. Third is changes and differences. Changes that a person experiences in his or her identities, roles or relationships, and differences demonstrated by unsatisfied expectations, feeling dissimilar. Critical points and events defined as markers such as death, birth, the suggestion of menstruation, diagnosis of an illness, these all are triggers for change. The transition can be single or multiple, and the people who are experience multiple transitions are simultaneously, and their degree of overlap and a sense of association between separate situations initiate transition in a person. There are some conditions such as knowledge, skills, physical well-being, environment, emotions, culture and beliefs and socio-economic status in the society may affect the consequences and quality of transition. Because according to Mellis 1994, these conditions facilitate or hinder progress toward achieving healthy transition. There are some major assumptions. First is nursing. Nurses are primary caregivers of the client and families who are undergoing transition process. Nurses guide and encourage them for their engagement in the transition process for healthy outcome. Person transition involves in a process of movements and changes in fundamental life pattern of all individuals. Health Malice defines health is a mastery, and she tested that definition through proxy outcomes variables such as perceived well-being and ability to assume new roles. Environment. Vulnerability is related to transition experiences, interactions, and environmental conditions that expose individuals to potential damage, extended recovery, or delayed or unhealthy coping. At last, I can say that transition theory play an important role in nursing practice. According to Malice 2000, role transition clarifies and specifies the major role of the nurses. It assists nurses in assessing the vulnerability areas and demonstrates that providing education prior, during, or following the transition increase the likelihood of successful integration into new role. There are some references. First is Malice 2000 theory and emerging middle range theory. Second is transition theory, Malice 2007. And third is Malice 2011, transition theory, middle range and situation specific. Thank you.
Hi everyone, this is Marceline Joy Sible, and I'm here to talk about the case study followed by the interventions. So there's a 70-year-old female patient, Mrs. T, who came into the clinic complaining of headache, dizziness, and pain in the back of her neck. We took her vital signs and her BP reading was 130/90. She said she forgot to take her hypertensive medications the previous days because she was busy dealing with other things. She took one tab of her 10 milligram Norvasc and later on felt better. She's been experiencing fatigue, joint pains, headache, dizziness, changes in appetite, weight loss, and changes in sleeping patterns for a few months now. You explored more about her, and she shared that she's a caregiver for her husband, Mr. T, who has dementia and had a stroke just 3 months ago. So she further disclosed that she doesn't have enough knowledge about stroke and dementia. She became emotional as she mentioned about the change in the relationship with her husband. It became stressful and troubled. Mr. T's dementia has been progressive, which also affects their relationship as a couple. Their children, K and J, don't often come to visit them as they both live in different countries and have their own families to take care of. Their children see them approximately twice a year. So, since her husband had a stroke, she lost interest in meeting with her friends and relatives. She described herself as withdrawn. Mrs. T has a younger sister, Mrs. B, 68 years old, who lives in another province and who is chronically ill. Mrs. T talks to her sister on the phone but doesn't ever mention about her current situation as she doesn't want her to worry. She answered same reason on not talking about her situation to their children, friends, and relatives. Mrs. T doesn't have anyone to talk to about how she feels, and that she's hesitant to do so. She feels like she will become a burden to them. Other than taking care of Mr. T, Mrs. T is also the only one doing the housework without any support. So she also stated, I feel physically and emotionally tired, but I can't leave my husband in that situation. You left Mrs. T for a moment, and when you came back, you saw her praying while holding her rosary and in tears. So these are the following interventions: determine stressors, identify her strengths, assess her understanding of the situation, explore her needs, use empathetic communication, check and assess for risks of harming herself and others, determine support systems and patient resources. If they're not applicable, offer accessible support groups and community resources. Encourage relaxation techniques such as mental relaxation, music therapy, or maybe guided imagery. Refer to social worker for access to community resources if needed. Refer to refer for counseling to facilitate in development of coping and problem-solving strategies. So, other the aforementioned, the nurse can also do the following: establish an establish appropriate and effective coping strategies in her role transition. So she's transitioning from uh, her wife role to caregiver role. Assess her readiness and willingness to learn more about Mr. T's illness, stroke, and dementia, and give her the information that she needs. Also, do health teaching to her on stroke and dementia management for her husband and on hypertension management for herself. Thank you.
Hi everyone, I am from group 4 and myself is Patel Preksha and I will be explaining goals and evaluation for our case study scenario. We are presenting a case study on transition theory. So for case scenario of Mrs. T, now we'll make goals in that Mrs. T shares or ventilate her emotional feeling with her family members or nurses taking care of her. Mrs. T has knowledge about stroke and dementia so she can understand her husband Mr. T's behavior. She has notified healthcare professional, nurses, or her family members about noticing any change in her health status. Any ups and downs in her health status. Mrs. T expressed her stressor with family members. Mrs. T communicate her needs and negotiate with others to meet those needs. She describe and initiate about effecting coping strategies. Mrs. T describe positive results from new behavior. Mrs. T focus on the present situation. Mrs. T identifies personal strength and accepts support through the nursing relationship or through the nursing communication. Mrs. T makes decision and follow through appropriate action to change provoking situation in her personal environment. So she should be able to make her own decision. Mrs. T use available resources and support system whenever she feels physically or emotionally exhausted or tired, or whenever she needs support, she needs help. Mrs. T expressed feeling in meeting with her friends and relatives. Mrs. T talks or ventilate about her health situation or feeling with her sister, her children, her friends, and relatives whenever she needs to do so. And last, Mrs. T gets help or support to do household work from her friends, her relatives. So, those are all goals we set for Mrs. T. And we also decided nursing intervention for Mrs. T. And after implementation of our nursing intervention, we'll see results after 4 weeks of interventions. So that will be evaluation. So, what are the changes we'll notice after nursing intervention? So, for evaluation, after 4 weeks of nursing intervention, Mrs. T will recognize her own strength and abilities to cope up her stressor. She will identify her own crises and initiate about effective coping strategies. She will demonstrate increase in self-esteem. She will determine her understanding of the stressful situation. She will ventilate her emotional feeling with her family members or nurses who took care of her. She will explain about stroke and dementia so that how it affects her husband's behavior. She will notify any changes in her health status, any ups and downs, any changes to healthcare professional or her family members. She will express her stressor with her family members. She will communicate her needs and negotiate with her family members to meet those needs. She will focus on her present situation. She will identify her personal strength so that she can accept or support through the nursing relationship. She will make decision and follow through appropriate action to change provoking situation in her personal environment. She will use available resources and support system whenever she feels physically and emotionally exhausted or tired. She will express her feeling in meeting with her friends and relatives. She will talk or ventilate about her situation or feeling with her sister, her children, her friends, and relatives whenever she needs to do so. She will get help or support to do household work from her friends or relatives whenever she needs. So, those are all intervention. For the references, you can refer Wayne G 2016 Ineffective Coping from website. Thank you so much.